Okay, great. Well, welcome everyone, and thank you for joining our Reducing Nurse Burnout, Enhancing Staff Safety, and Eliminating Referral Leakage webinar. With me today is our VP of Microsoft Business Applications, Sarah Camden Howe. Welcome, Sarah.
Hey, Brittany. Good afternoon. Great to meet you all. My name is Sarah Howe. I'm our VP of Microsoft Biz Apps at Imperium. Super passionate about the healthcare industry and how technology can transform processes and improve patient outcomes. And I've been implementing Microsoft solutions in the healthcare space for customers worldwide for almost a decade. Great to meet you.
Great. Thank you, Sarah. And really quickly, if you're new and joining us here today, we are Imperium Dynamics, a proud Microsoft partner based in downtown Chicago, dedicated to bringing your vision of life within the Microsoft stack. We aim to help organizations of all sizes achieve digital transformation by solving complex problems and delivering long-lasting impact through the Microsoft Cloud solutions, with the focus, of course, of increasing both the capabilities of people and the performance of businesses. And before we get started, a few housekeeping items. The session is being recorded, and you will receive an email with the link to access the recording. So feel free to revisit it or share it with your colleagues. At the end of this session, there will be a Q&A. So please feel free to submit your questions throughout the presentation using the chat feature, and we'll address as many as possible. We will also be sharing additional resources as well as a copy of today's slide deck after the session, so you don't have to worry about taking detailed notes. So with that said, let's dive right in. Our agenda today includes an introduction to Microsoft ecosystem in healthcare, as well as real-world use cases and outcomes when it comes to nurse burnout, staff safety, referral leakage, and information management. And we will be ending it off with some live demos showcasing how Microsoft Solutions is transforming the healthcare industry. So with that said, I'll hand it over to Sarah.
Awesome. So to set the stage a little bit, we wanted to talk today, around why would we look at Microsoft as a vendor, as a healthcare provider, and I wanted to set some context for, a bigger picture vision here within the healthcare space for based on kind of where we're at today, typically in the healthcare provider landscape, and then where we could be in the future. So, from a traditional perspective, the healthcare IT approach is very point solution focused. We're buying single purpose apps as SaaS solutions or pre-built solutions off the shelf, and they're fit very much to a specific workflow. They're also, of course, complementing the EMR whenever it's something that's a clinical app in nature or touching the clinical systems. And then what we're ending up with is a lot of disconnected systems. So they're not necessarily integrated with each other very well, and that does cause some reporting challenges. So if we take it all together, what we're seeing is, an average hospital system has 300 to 500 different IT applications, which translates into unnecessary costs. Brittany, if you can put the diagram. Um, the unnecessary costs and a lot of data silos, which impact operational efficiency. So if we look at kind of where Microsoft can play a role here, it's really with vendor and application consolidation. So here, this diagram kind of represents each of these as a database in your organization. And with all of the low-code applications that Microsoft provides, we can actually replace solutions and migrate them onto Power Platform, Dynamics, or Azure, and that will reduce the costs while also improving operational efficiency. So the end vision is to remove as many data silos as possible, and we're left with, the EMR as well as Dataverse, hosting most of the data, and we have many different purpose-built apps on top of that that are all connected and sharing a data set. And then, of course, this is a little bit of an idealistic version. We could never end up with just two systems, but The point is that as many of those different silos that we can remove, we can both save costs and increase the smoothness of the operations. All right, next slide. Thank you. So, yeah.
Yeah, great. Thank you, Sarah. And then when it comes to the impact of Microsoft in healthcare, Microsoft enables organizations to transform the ways teams operate and communicate. So when it comes to low code innovation, it refers to how hospitals can respond to internal needs faster, whether it is for processes, requests, or communication without long development cycles. The agility helps teams move quickly and adapt as needs change. Building on that agility, data unification focuses on eliminating fragmentation by aligning data across departments. So when information is centralized and consistent, it becomes much more easier to reduce confusion and operate as one coordinated system. And finally, when we talk about scaling transformation, it ties these elements together. Once the right tools are unified with the data, they are in place, and hospitals need to expand those processes across different teams. So Microsoft sort of supports this by enabling scale while still allowing customization to meet specific needs. So again, when it comes to low code innovation, what Microsoft can do is automate updates and messaging, set up FAQ and support bots, create ticketing and intake apps, as well as handle requests with simple forms. So some of the solutions there when it comes to low code innovation, when we talk about the unifying of data, it centralizes your data and files into one place. It syncs your SOPs and brand guidelines across all of your teams, as well as it provides a unified marketing and operations data, overall aligning teams through this unified data coming from Microsoft. And then again, mentioning scaling transformation, it allows training for co-pilots and agents across company knowledge, as well as it automates CRM updates and reminders. It uses the same training across teams, and it keeps your workflows clear and consistent while also providing that personalized system at scale. So a little bit about the impact of Microsoft in healthcare. Moving on to the platform that Sarah mentioned, what is Power Platform? Power Platform is a suite of tools that empowers users to take action on their data. So it solves businesses challenges and streamline operations all without needing deep technical expertise. So these low code tools such as Power Apps and Power Automate are helping healthcare organizations drive innovation without the need for extensive developer resources. So hospitals can quickly build custom intake or ticketing apps to manage internal requests. So from IT to support to maintenance and HR inquiries, these apps often rely on simple forms, making it easy for staff to submit and track requests in a structured way. Additionally, organizations can automate routine updates and internal messaging, reducing the need for manual follow-up and improve communication across teams. So hospitals are also able to leverage that AI-powered chatbots to handle internal and external FAQs or just provide basic support, streamlining responses to common questions and freeing up the staff for more complex tasks. So together, these low code solutions accelerate process improvements and help overall reduce administrative burden across the organization. So a little bit of the Power Apps, the agents, Power Automate when it comes to replacing repetitive tasks with intelligent workflows that connect systems and respond to events in real time, as well as utilizing Power BI, turning that raw data into interactive dashboards and reports that help team uncover insights and make informed decisions. So all of these tools within Power Platform utilize and help one another to provide hospitals with the information and the tasks that they need. With that said, I'll hand it over to Sarah to talk a little bit more about the complete low code platform here.
Yeah, thanks, Brittany. So, as of this year, Power Platform is rated as the #1 low-code platform of all in the Forrester report, and it's because it is both scalable, cost-effective, and advanced when it comes to the development tool set for low-code apps, whether you are looking to build citizen developer skill sets or you have an in-house development team that's going to be using this for rapid application development. So the different components, right? Power Apps for app development, Power Automate for workflow automation, Copilot Studio is providing chatbots and the agentic um, future. And then we have Power Pages for websites and web portals, and then Power BI for the reporting aspect. And all of this is built on top of Azure and using Microsoft Database as the cloud native database. And our data is always going to be stored in your own Azure tenant where you have complete ownership and control of it. Then on top of that, we're able to, because we're in Azure, utilize many forms of AI and different types of AI capabilities on top of all of that data, whether it's copilots or using different types of predictive analytics and so forth. So it really has the full package and it allows us to transform business processes quickly and in a very dramatic fashion with AI at the forefront. And along with that, since we're in healthcare here, we of course want to talk about the governance side. So Microsoft is very advanced when it comes to security. We've complete role-based security and across the board. And we have different processes in place that allow us to manage, like keep our environments secure, our data secure, and then manage all of the different applications and environments within the tenant, as well as monitor and control all of the ongoing maintenance of those apps. So this has purpose-built applications called the Center of Excellence kit, and you can deploy that. It gives you many different dashboards and views to maintain and administer an enterprise-wide application environment. So if we think about looking towards the future, right? AI is everywhere, automation is everywhere. Where can we start with that application consolidation journey? And the answer is really anywhere. Whatever departments you are thinking of, or that might have maybe the most outdated processes or outdated systems, the most manual processes or redundancy, those might be areas to look towards first. But every department in your organization would have opportunities to transform with AI and automation. So we take a deeper look in the next slide. Um, Here are some examples of different processes that you could look at by department, from clinical operations to marketing, customer service, legal, HR, finance, and IT. Um, these are areas where you can really sit down with your different business leaders in these departments and try to do some use case ideation and talk about what are some of the pain points, what are those manual processes, where are things currently error prone, or requiring a lot of unnecessary effort potentially. And those are areas that we can look towards for automation solutions, as well as looking at, systems that are maybe outdated and are on the list to sunset. Those are really good candidates versus buying a SaaS solution. You can look for Power Platform based solutions that provide those same workloads to bring your data together into a more consolidated space while migrating those workloads into a more cost effective and scalable solution with Power Platform. So that's kind of a process. We typically work with customers to help them ideate across departments and then rank and prioritize use cases based on the complexity, the ROI, the time to value, and other constraints.
Thank you, Sarah. Next, we will go over the real world use cases and outcomes. But before that, some current industry challenges that we are seeing in the healthcare industry here is when it comes to many hospitals continue to rely on outdated IT systems that add unnecessary administrative burden to clinical staff, pulling their attention away from direct patient care. So instead of enabling efficient workflows, these systems often require time consuming manual entry, duplicative documentation, or complicated navigation. So, all of which cut into time with patients. And this overall adds the growing strain on nurses, nearly half of whom reported plans to leave within the next 3 years due to stress, burnout, and chronic understaffing. So these individuals' decisions reflect a broader systematic issue as the US faces a projected shortage of 200 or 450,000 nurses by 2025. So without better tools and support systems in place, hospitals risk accelerating staff turnout and worsening gaps across the industry. And then when we talk about staff safety, the workplace violence and hazards remain serious but often underreported issues in hospitals. So, creating risk not only to staff's well being but also to the overall workplace safety. Many incidents go unrecorded due to the unclear reporting process, the fear of retaliation, or the lack of follow up. So, making it difficult for leadership to grasp the full scope of the problem. So at the same time, hospitals frequently lack the standardized workflow for conducting and approving hazard assessment. So without a clear, consistent process, it's really challenging to identify patterns, prioritize interventions, and ensure accountability across departments. So this lack of structure ultimately delays corrective actions and weakens the hospital's ability to maintain a safe and supportive environment for both staff and the patient. So a little bit of the top two challenges when it comes to nurse burnout and staff safety. As we talk about the other two, referral leakage and information management, referral leakage remains a major operational and financial challenge in hospitals and in the healthcare industry. Missed patient appointments alone contribute to an estimated 500 million loss in annual revenue. But this isn't just about no-shows. It is because of the systems. And many hospitals, referral calls and scheduling often happen across a bunch of disconnected systems. So overall, making it really difficult for staff to monitor the patient's journey or ensure the follow through. So without a centralized visibility, patients can easily fall through the cracks. And additionally, much of this process remains manual. So, from making outreach calls to coordinating follow up care, these delays create long wait times that frustrate patients and reduce the likelihood of them returning for recommended care, directly contributing to the increase of leakage. Moreover, hospitals often face inefficiencies due to the difficulty of accessing internal knowledge and policy. So, whether it's clinical guidelines, HR protocols, or IT procedures, staff frequently struggle to find up to date information quickly, especially during urgent situations. So, this challenge is compounded when organizations rely on third party help desk models, which may introduce security and compliance risks. So, particularly when sensitive health or operational data is involved, without full control over the information it's handled and stored, hospitals face greater exposure to data breaches or policy violations. So, another challenge is the lack of a centralized digital system for managing safety related data. So, when important safety records or compliance documents are spread across email threads, spreadsheets, and outdated platforms, it becomes difficult to maintain accountability, keep information current, and prepare effectively for audit. So, this fragmentation increases the risk of oversight and can compromise both staff and patient safety. So, with those four current industry challenges there, I will now hand it over to Sarah to talk about how Microsoft and Imperium Dynamics was able to solve these challenges.
Yeah, so in the remainder of the session, we'll be talking about some real world examples and solutions that we have on top of the Microsoft Power Platform that you can buy as an off-the-shelf solution, but from the back end, it's built with the Power Platform tools. So we have, the ticketing management agent, and this we deployed for Baptist with a use case around help desk ticketing for their clinicians. So they were very concerned about um, their clinicians just spending unnecessary time. They're already burdened with a lot to do, from seeing patients to documenting everything in the electronic health record. And on top of that, whenever there were issues with the EHR or other clinical systems, they were spending 7 to 10 minutes on the phone with the help desk to get someone to hear their issue or support them. So they were actually able to remove that outsourced call center and replace it with this chatbot interface that was integrated into the EHR. And it was integrated as well with the knowledge content from their internal intranet site that had all kinds of help articles around the different clinical systems. And they were able to allow the users to search from those articles, and get responses to their questions based on different search terms or natural language searching. And then on top of that, so they increased the utilization of that help content by 300%. And then they also had role-based access to be able to create help tickets directly if there was a bug or an issue, attach screenshots, and then even submit tickets on behalf of other members of the care team. For example, a nurse might submit a ticket on behalf of a physician. And then with that, they were able to reduce and minimize the need for phone call support, giving clinicians tons of time back. And they reduced the average time to open a ticket from 7 to 10 minutes to 60 seconds. And they also reduced the knowledge retrieval process and time to just about 60 to 90 seconds. And as I mentioned, increased the utilization of that content by 300% as well. So this is an example of an agent or a chatbot kind of stepping in to help automate a process and take away some of the manual steps and make things smoother and faster and more accessible using generative AI and agentic capabilities.
Great, thank you, Sarah. And I can actually show an example or of the similar bot that was able to help Baptist Health as well. Let me see. Can you see the agent here?
I can.
Okay, perfect. So this is a Hampton agent similar to the Cassie agent that was implemented for Baptist Health. And if I start by just saying hi to my agent, and let's say that I'm actually a clinical nurse and I am looking for how do I create a new patient referral on Epic. So here the agent has replied with, hi, what can I help you with in terms of your Epic workflows or creating a ticket? And I have the options to submit a ticket, view ticket status, or search for articles. And first, I would want to search for articles that have to do with how do I create a new patient referral on Epic. So then with that, what my agent now is doing is searching for the solutions for me in terms of the questions that I had. And here it is looking for similar articles within my hospital SharePoint folder. And here it was able to give me step-by-step on how creating a new patient referral on Epic EMR for surgery. So first open the patient's chart, navigate to the referral section, and here it's giving me step-by-step. Now let's say that I read all of this information and it's still not the actual answer that I'm looking for. So by clicking not satisfied, now I can submit a request, whether that's a question or an actual IT problem. But here for a request, I can ask it for a question, and then it will ask me to fill in my title here. So would be the same. How do I create a new patient referral on Epic? And then it's asking me to select a topic here. And then my issue would be on surgery. And then if I do the right similar thing over here, again, trying to find the actual information. It's doing the same here, trying to find it one more time. And then here by selecting type of ticket, the questions, enter referral type. And then I say creating, kindly select the product, Epic EMR. And then let me see. If I scroll down, kindly select the priority level. Let's say that this is actually just a medium priority for me. And then here it will give me details of my claim submission when it comes to the type, whether it was a question or request, the title, the subject, what kind of referral, and then the type of referral as well as what EMR it is for. And after that, if all of the information is correct, I can either confirm or edit. And once I hit confirm, it will take it to the IT ticketing team so it can help me with my question that I have. So a little bit about Cassie there, and then I can hand it back over to Sarah to talk about another use case that we have. Oh, Sarah, you're on mute.
Thank you. Can you see my screen now?
Yes.
Okay, so the next solution we wanted to showcase is the Imperium Job Hazard and Safety Analysis tool. And this is really for helping to maintain and prevent incidents within the organization. So keeping compliant with OSHA standards and automating the process of identifying and assessing risk throughout the different departments and spaces in your organization. So here an example of one of our customers, Indiana University Health. They are a large 40,000 employee hospital system with 16 hospitals. And for them, they were really focused on nurse safety primarily, as well as, environmental safety and some other departments as well. But they wanted to make sure that they were able to really prioritize and go through each job category and capture all of the different potential steps in the process, as well as the hazards for each user role and each process. So here we were able to give them a really unique blend of customization and templatization that no other vendor in the market provides. By creating a hazard library. So our product comes with a fully built library with thousands of options of different steps for different processes in healthcare industry. And then you have the associated hazards as well. So when you're creating an assessment, you're not starting from a blank slate. You actually have options that you can see and suggest based on the industry, the role, the department, and the type of process. But then you're also able to tailor them and make them very specific to your space and your team's processes. You can also add your own, of course. So that gave them that really tailored experience when it came to creating the assessment, so they're not missing any potential risks or hazards. And then in this, it's taken like a survey format. So a safety admin kind of sets up the assessment and then assigns it out to either individuals of the safety team or individuals of the department that's being analyzed for them to complete a survey about the different hazards involved in each step of the process. And there they can rate them by probability, severity, and other metrics that are used for calculating the risk level according to the OSHA standards. So from that, then we have automated reporting that's actually summarizing all of the data that's captured from those hazards and helping them to identify the highest priority risks, as well as capture actions from user input to improve the processes, and then track those through to completion and implementation. So we're ultimately giving much more control over the job safety within the organization end to end, which ultimately has a big financial impact by reducing the number of workers' comp claims that you're getting and then having to pay out to. So, and then along with that, we're getting higher rates of incident reporting as well. So a little bit of a glimpse of what that solution looked like. So here are Imperium Job Hazard Analysis solution. When I log in, the first thing I'm greeted with is a dashboard. And I'm logged in here with my Office 365 user from Azure AD, and I'm in a web browser, although I can also run this application within Teams as well. So here I have navigation, and this is what we call a model-driven app in Power Platform. And I have a Power BI report that's embedded within my dashboard. So here I can see, filters for the different hazard types according to OSHA, right? We've got, psychological, physical, ergonomic, chemical, and so forth. I can see how many high-risk hazards I have, the breakdown of their types, how many actions need to be taken across the organization, and the average risk severity. But then if I come down into this detailed breakdown, it's actually listing all of the hazards that were reported against the specific activity and their risk scores with color coding to highlight the most important ones that need to be acted upon. I can also see at a glance the current control measures and PPE, as well as the actions that are suggested for changing the process and making it more safer. So this is that kind of administrative view that gives you that summary and holistic picture of the workplace safety across the organization. And if I come into conducting the job hazard analysis, we have a setup wizard that allows you to create those tailored surveys for each department. And on the job hazard analysis record itself, this is where the safety team can define the pre-risk qualification, the post-risk qualification, and then once those are completed, they're able to send those out for approval, and the follow-up actions can be tracked here as well. So every time an action is reported, it's created as a task that can be assigned to a specific individual, given a due date, and then closed once it's completed. And we're also able to see and track the assessments against different roles and job categories, departments, and locations as well. So here you can also see the submission history of who has taken that assessment. And if we come into our report section, we're able to see that summarized view of the specific JHA assessment and the data that was captured from there with the risk scores, pre-risk compared to post-risk scores after implementing some control measures, the reduction level, as well as the hazards that were reported. And then we also have versioning and dates. So you can have an expiry date. Maybe you want to reevaluate each process annually. So it will let you know which ones are going to be upcoming, expiring this month, expiring this year. And then you can see previously expired ones. You can update them, or you can just restart the approval process. So this is giving that end-to-end support for automating and maintaining the OSHA compliance. And this is something implemented at Indiana University Health, as I mentioned. Next, we have our referral leakage solution. So this one is a really neat solution that's helping to automate and improve patient engagement and capture rates when we have external referrals or even internal referrals. And it really centers around capturing the patient information and data, whether you're getting your faxes from if your referrals are coming in from fax or whether they're in your EMR already, we can pull those in and use AI to automatically capture and extract all of the patient data, match it to the right patient, and then based on that, we have the ability to configure personalized scheduling cadences. So these could look like automating text messages, phone calls, and even auto dialing out to patients to help them schedule and book that appointment that they were referred for. We're then tracking those booked appointments back to the original referral. So we're getting the leakage analytics and we're able to break those down in a number of different ways by provider, by patient, by demographics, by location, and help with root cause analysis for patients that don't book. So a little bit of a glimpse of that I wanted to highlight on is the customer insights journeys, um, which is leveraged here within our referral solution. And you can see that there's logic here. So when a PT referral is received, for example, it's going to check the patient's age. And if they're older than 75, it's directly going to be doing the phone calling. But if they're younger than that, they'll get a text message instead. And then it's going to check if they have consented to text. If they have, they'll get the text. If not, then it will get the phone call as well. And then based on those, we can have multiple tries or different branched flows based on the interaction of the patient with those steps. We also have the ability to automate emails through here and do outbound auto dialing through Dynamics Contact Center as well. And as part of that, I also wanted to lead into, Dynamics 365 Contact Center. So many healthcare organizations today are looking to modernize their call center operations. Dynamics Contact Center has the best platform for supervisor monitoring and integration with other systems. So we can provide a unified view of the patient's record or the caller's record within the system and pulling data from multiple different sources. And there's a myriad of AI capabilities supporting quick replies, knowledge articles, suggestions, and helping with unified and intelligent routing to the right teams and individuals. Supervisors are able to monitor all the conversations, whether they're phone calls by reading transcripts or chat escalations, text message conversations, any open conversations, and they can provide consultation as well as directly engage with customers. And then we have the auto dialing capability as well. So in our referral example, we're taking that list of patients that have a referral and automatically calling out to their phone and then directing them back into the call center if they're looking to schedule the appointment. So, a couple of high-level examples there from a contact center perspective. And next, we can talk about Acadia. So, this one is a document processing or document lifecycle management solution. It's more from a legal or sales perspective typically, but it can be used for any type of document, whether you're creating internal documents or customer-facing documents, as well as reviewing inbound documents from external parties for your legal team. So this uses AI to help you with things like first line of review, summarization, comparison of different versions throughout the redlining process, as well as automated feedback and collaboration with the customer and your internal teams on drafting documents. It also helps you to automate the sign-off process with DocuSign integration and Adobe Sign integration. So I'll give a quick glimpse of that one as well. So here I'm in another model-driven app, and here you can see my document. And this one has a business process flow at the top that's guiding through the steps of review from initiation to attorney review, external review, negotiations, approval, and execution. And I have a lot of document details that have been extracted from the text of the actual document. Similarly, I can also use this AI chatbot to ask details about the content of the document itself. Um, and it will provide a summary based on the content. So here it's saying the provider service agreement involves medical group, and it's going to give some restrictions around the provider relationships there. If I come here, I can see the actual document, which is embedded from SharePoint, and it's in a Word format. So I could directly make edits to the document from here if I have the role-based permissions for it. And I also have AI summaries, clause reviews, redlining processes. So a lot of other processes built in throughout this. So there's lots of different ways that this streamlines and reduces the time or the turnaround time for contract execution. And this one is built on Power Platform as well as Azure AI primarily. Now, from here, we'll talk about our last use case, which is provider lifecycle management. And this one is really more for payers, but it can also be used for providers as well. But it's managing the recruitment and onboarding for providers. So if you're a payer, right, onboarding your like different hospital networks and all of the physicians that are going to be covered under the plans. And if you're a hospital system, onboarding physicians into your staff, or maybe external physicians that are going to be on staff eligible and so forth. So here, there's a lot of collaboration, a lot of onboarding processes, paperwork that needs to take place, and this can all be automated and facilitated using a portal in Power Pages. So I'm going to show this as well. So you can see I am logged in here into this portal, and here I have different areas in my navigation: assigned tasks, assigned contracts, practitioner onboarding, and bulk uploads. So if I'm a healthcare provider and I have, hundreds of physicians that I'm looking to onboard for a new payer, I could just download the Excel template and upload it, and then they're going to move into the onboarding process and credentialing and verification. I can also upload one by one. And once I've uploaded, I can see the status of each of those different physicians, how many referrals they've received in the current year. And I also have the ability to see contracts that are currently in progress. So if I open one of these, I can actually complete the document review. This is where I can add comments and complete that negotiation process and collaboration. And if I go into sign off, it will open into the DocuSign where I can sign that off. All right, so yeah, this is a Power Pages portal built on the Power Platform framework as well. And I have, specific privileges that are set for my external user, even though I don't have an Azure AD login. So that's another example of a scenario here. And with that, we can kind of conclude the demo portion. And I just wanted to summarize the session today by, data is one of the most crucial pieces in our organization. It's most valuable, but it can also make or break our processes, the way that we manage it. So with Microsoft tools, you can really improve your overall data estate and health, where you'll know where you have data, where you don't have data, and you'll be able to use it and find actions from it. You'll also be able to enhance your customer experience as well as your internal employee experiences. And by improving your operations with connected applications that support each other. And then we also have, the AI, right? The AI future that's here, utilizing AI to reduce the time spent on different processes as well as improve outcomes. So these are some of the key areas for your organization's strategy around data, and Microsoft is really the best place to go to support that vision. Awesome. With that, I will hand it back to Brittany.
Yeah, thank you so much, Sarah, for those detailed use cases. So, as we've seen, hospitals today face significant challenges that impact both staff and patient care. Outdated IT systems place heavy administrative burdens on clinical teams, pulling them away from caring patients. And this adds to the stress and burnout that many nurses experience, contributing to high turnover and threatening the care quality. At the same time, issues like underreported workplace violence and inconsistent safety workflows compromises the well-being of staff and overall hospital safety. And on the operational side, referral leakage and disconnected systems create gaps in patient care and revenue lost. And finally, again, like Sarah mentioned, the difficulty accessing critical knowledge and fragmented data further disrupts responses and comply. So to address these challenges, we've leveraged the entire Power Platform ecosystem to build integrated AI-powered solutions that streamline workflows, centralize data, and enhance communication across hospitals. So this unified platform enables hospitals to improve operational efficiency, support staff better, and deliver safer patient care, as well as helping them transform in a rapid evolving healthcare landscape. So, a little bit of recap of the healthcare industry's challenges, as well as how Power Platforms ecosystem can solve them. So with that said, we hope you've had a insightful session and that we've delivered knowledgeable aspects in terms of how Microsoft is helping the healthcare industry, as well as how you can leverage Power Platform and its entire platforms together integrated to help those challenges. Thank you so much, Sarah, for speaking in this session.
Thank you, everyone. Thanks, Brittany.
Bye. Thank you.